Working on the skull, craniosacral therapy, as it's often known, is sometimes seen as baseless, without justification, and sometimes even ridiculous. However, its real justification is contained within some very simple anatomy. So very simple and easy to follow anatomy, and understanding the tissue types and how they're capable of moving, and how the body is aware and concerned with that movement. Starting out, let's talk about the sutures. The skull has many different sutures throughout its whole circumference, and they're in different shapes and orientations, and these are all very important to the way they function. The fact is, there is sutural tissue, fibrous tissue, in between these sutures. We're looking at here a toothy suture, lock and key suture, whatever you'd like to call that. But we have a left and a right bone, two interfacing bones, and between them, even though it's a small space, it is a very small space, there is fibrous or soft tissue between. And this tells us there is a capacity for movement. The fact that we've put this fibrous tissue here, the fact that we all have this, and this is standard in everyone. If, on the other hand, we didn't want any movement, if we wanted no movement through the sutures whatsoever, and that movement was important, what we could do instead was make it so that the whole thing was fused straight through with calcium. We'd just cover it right up, and we would truly have an unmoving skull. We would just cover all these, blanket them over with calcium once we reach a certain age, and it wouldn't be relevant. However, that's not the case. We have a lot of sutural fibrous tissue between them, so it indicates that it moves. And if it does move, and it does so in most people, it must be important. The fact that these move indicates some kind of a pressure balancing mechanism. And there are certainly some ways you could take this, many different ways in fact, but because they expand and because of what's underneath them, it shows that it wants to balance out some of the pressure. Its movement is relevant, and we should treat it as such. Underneath these skull bones is, of course, our brain. And that brain is very, very important to, well, everything. Around that brain is cerebrospinous fluid, a fluid the brain floats in, as well as the spinal cord. In this case, we're mostly concerned with the brain. And it protects the brain from outside forces, from impact forces, and from just general motion of the skull. Twisting around, the brain goes with that, and if there was no fluid barrier, it would hit the skull far too hard and damage it quite significantly. However, it's not a perfect system, and so we need protection from outside impact forces, and as well, that fluid production is constantly going up and down. It is constantly increasing and decreasing. So the change in pressure is both external and internal. So we need another system, something else to balance this force out. Internally, of course, it does a good job, but externally we need something too. And this comes in the form of the sutures. As they expand, as they allow for even small amounts of expansion over the total circumference of the skull, they do in fact allow for small amounts of pressure balance. And this doesn't seem important. This doesn't seem like it would be a big deal. But over the course of your entire lifetime, or even just over the course of a day or a week or a month, this is quite a bit of expansion and quite a bit of pressure balance. Try to understand that the brain is a very weak tissue. It's very, very soft. And when it is impacted, it folds quite a bit. It is described as wet tissue paper. And it's so delicate that it needs as much pressure balancing as possible. If you were given the option to tell me which was stronger, the skull or the brain itself, I should hope you picked the skull. You would be right in that case. And so whatever we can do to ensure that the pressure does not back up onto that very sensitive, very delicate brain, it's incredibly important that we do that. We should take every opportunity to do so. And that's what the skull does. It allows expansion of those sutures and makes sure that brain stays as safe as it possibly can. And we're lucky to have this. So, if the sutures are all about protection It must mean their failure to work should be something the body would be concerned with. If they are for maintaining health, maintaining an ideal state, the body should want to be aware of. And of course, it is aware of things through our nervous system. The sutures, like any soft tissue, like all soft tissues, has nerves that go from it to the central nervous system. There will be bigger and smaller nerves, of course, coming from different places. And there will be little receptors, tiny, small things, much smaller than I'm drawing here, on those sutural tissues that pick up changes in tension and pressure, again, just like any other soft tissue. And so, for instance, when that soft tissue is pulled too hard upon, and we have some strain and probably some pain that goes along with it, whether you experience it or not, these receptors are capable of picking it up. And they send that message back to the central nervous system. And like anything else, if we have sensory information coming in, we should have a reaction. When we have an afferent going in, we have an efferent going out. And oftentimes that efferent goes to muscular tissue in the form of muscular contraction, but as well sympathetic activation. As a simple example, we have within our skull the trigeminal nerve. It has 3 trigeminal nerves, and one of the branches, the ophthalmic, in fact goes to the dura and to some of the sutures inside the skull. For instance, the frontal or coronal suture would be innervated by this particular nerve. If it was to detect some kind of sensory aberrance, whether it's being pulled apart or even if it's stuck, it would detect it through its nerve, go back to the central nervous system, interface with what it needs to, and then potentially it could come out in the form of a muscular contraction along another branch, let's say through the mandibular nerve, which innervates many of the tissues of the jaw, the muscles of the jaw, masseter, pterygoids. And the change in tension here could result in a change in tension here as well. It turns out too, if the pressure and the maintenance of that pressure is important, even though strain is a bad thing, restriction in motion, stopping motion entirely in a certain area at one point or multiple points, is equally a problem. Because if it's for balance, the body should want to detect this too. And in the same way, this restriction in motion is alerted to the central nervous system, and we can again have the same effect. Now, in this case, we may have muscular tension come up in the form as not as so much a stress response, but as a way of mobilizing that tissue. If there happens to be a muscle that pulls on this area, a really good example, say, is the frontal muscle, the frontalis, and maybe through its shared tendon, the occipitalis is worth mentioning too. We can change the tension on a suture in an attempt to mobilize it, and as the body does with many other joints. The skull is just another part of the body. And so that means we can change the way that suture works internally. It's hoping to do that. Now, of course, our sympathetic response, our stress response, is equally important. Anything that tends to be immobilized or strained for long periods of time, because we have a high amount of sympathetic or fight or flight fibers in all of our soft tissues, we can see that it changes the way the body works. It may lead to stress responses throughout the body, in fact. Changes in blood flow away from the gut towards the heart and lungs, or changes in, eventually, muscle blood flow. And these are important things. We want to prevent these things, these sutural restrictions, because they do affect the body. They can affect the brain, but they can affect the body as a whole if given a long enough period of time. So we should know how to deal with that. And again, our simple understanding of anatomy can explain this quite well. So for instance, let's take just a really simple suture type, what we might call a lock and key or a toothy type of suture. Notice that we've got the 2 interfacing bones here. And because of that, because they interface and cross over one another with one bone over here and the other bone over here, they should want to move in certain ways. So if they are interfacing like teeth if they were to move up and down on each other, if they were to attempt to do that, they would probably break. This would be a really catastrophic type of motion for these particular bones. All these teeth would just fracture off. So that would be a really poor way for us to try to move it, or for it to try to move. Instead, if I told you that we could try and move the bones apart, separate them in this direction, or maybe go up on one side and down on the other, that's a pretty reasonable thing to say too, because the teeth, the shape of that suture, does allow for that. And we really do need to respect the body. We really need to respect the construction of the body and know that the way it's designed to move should be the way we encourage it to move. Another suture is what we might call a beveled suture. We have two overlapping bones. And so moving this around, because they are flat and beveled, somewhat triangular shape, they're very good at moving this way, and they're very good at moving up and down on each other. But if you instead attempted to move one anterior, posterior on it like that, again, we might see a fracture of the bone, or at least a pressurization in a way it doesn't like to be pressurized. And very likely it would react again if we had something happen where the bone was moved too harshly. Central nervous system would be alerted, and it would create a response, a negative response. Maybe a corrective response in the short term, but if it wasn't ultimately resolved, it may be too excessive and may go further down the chain, further down the nervous system, causing more and more problems. So treating this system, this cranial system, I should hope that your immediate response is that we should be delicate with it. We should be relatively gentle, because it is a very sensitive system and there are many parts involved. This is an incredibly simple way of looking at a very complex system, and I hope it makes sense. But the fact is, it means that we probably don't want to do high velocity thrust to the skull. I hope that's what you take from it. However, it is tissue. Do understand that between these sutures is soft tissue, and soft tissue responds to myofascial release. That is one of the ways we can address this, through direct pressure to the area. When there is a restriction in the tissue, when it will not open up, when it will not move and those sutures will not expand, we can use direct pressure like we would any other tissue, within reason, being gentle and paying attention to what the body is responding to and is not responding to. So it's fair to say that we can be very direct on these tissues without being harsh or forceful. In the same way, though, if we have a strain occurring, we have some kind of a separational force that is causing quite a bit of pain, we may consider that we want to reposition the bones. We want to reduce the strain within that region and get rid of the pain, because that would essentially reduce the tissue pull. That means we're getting rid of the strain and all of the painful and aberrant responses in the body. I hope that made sense. This has been Alge from Simple Lines Anatomy. I will say good day to you.